This month, HDNet Movies takes you on a journey.
I use my apps for work.
Into the heart of the Old West.
If it's action you boys want, the game's open.
Where legends are made and heroes come to life.
Hi.
Hi.
How are you?
I'm good. How you doing?
Fine.
Can I come in? Is that okay?
Well, not so good actually.
What's going on?
Well, I scheduled 2 appointments today. I didn't really, hey, come on, sit down.
Oh.
I didn't realize my prosthetic guy's going to be here sometime.
Okay.
Anyway, how are you?
I'm good.
I've been making some progress lately in my life, but I forgot. I don't know how anyway, I'm sorry. I apologize. He'll be here sometime soon.
It's okay.
Anyway,
Don't worry. My name's Yvonne.
Oh,
Yeah.
we haven't met, have we?
No. Nice to meet you.
Yes,
Yeah, that's okay. What time is he coming?
well, he said between 12 and 2:30, so.
Oh, okay.
Could be
You know,
now, could
here's
be-
what we could do. If you're okay with that, we can start and
Sure. Yeah,
and when he comes, we'll figure it out.
Appreciate
We'll
that.
see how far we get. How's that?
Okay.
So, do you know anything about Welby? Have you heard about us?
I received
This is for you, actually. Here, you want me to put it on your counter?
what is it?
It's some goodies for you.
Oh, really? All right.
Well, this I'll explain. That's the number to call when you need something. This actually does work. It helps you open up, like.
Oh, Bible?
Yeah,
Oh, okay.
I've used it
Uh-huh.
because I need it, and a pen, and then this is a magnet,
Oh, no kidding.
and
Yeah, I need one of those. Right?
Kleenex. Oh, there's a lot of stuff in here. Kleenex, and here's some alcohol to wash your hands with.
Oh, can I wash my little fat head with that? All right, thank you.
So I'll just set this here.
Sure. Yes, I appreciate that.
Of course. Yeah, my name's Yvonne. Here, this fell.
Oh.
Here you go. Here you go.
Do you have a card or anything with your number on it?
I do. Yeah, I'm going to give you all of that. Yeah. So what we are, you have this member benefit to you.
Yeah, the insurance company just sent me a letter about you guys. I didn't even have any idea.
Yeah.
So,
Yeah, it's really nice. It's no cost to you, which is nice. So these are the questions people ask me. Well, how did I get put on this? So you've had a change in your health in the last couple of years, usually. And the insurance company says, well, let's see if we can enroll Joe in this and see how he does. So the whole goal is to keep you home, out of the hospital, if possible.
Sure.
And even urgent cares too. So we're nurse practitioners.
Oh.
We're actually cheaper to come to your home than for you to go like to urgent care.
If you guys don't mind coming, I think that's great.
Not at all.
In the winter, my gosh.
Not at all. It's
Are you local? Do you
fantastic.
have to come by a long distance?
I live literally down the road.
Okay, so it's not a long thing. Okay.
Not at all.
The winter, you know the winters we have around here.
I know. Yeah, no, it's you call me and I come. And here's the good thing too. We're available 24/7. So after 5 o'clock, you can call us and you'll always speak to a clinician. There's always someone there. So even if you have a question, you can call. But we don't replace any of your doctors. Like, you still see all of your same doctors.
Yeah, I got 14 of them right now, I think.
14?
Well, some of them 11 and 14. But,
Oh my gosh.
well, you know.
That's a lot. So are you okay if we just start doing our,
Sure.
it's just a little assessment. It's
Yeah.
not much.
That's fine.
Um,
I went through one last year. I know what it is.
oh, you do?
Yeah.
Oh.
It's nice looking cat.
Isn't that nice? They did give us this. Isn't that nice?
Yeah, it's very efficient.
It is. There's a lot of pockets.
As I say, that's
I like the
deal.
pockets.
You got your laptop in there. Wow.
I know. We got everything. How do you like it here? I looked. I don't even think there's anything available here anymore to buy.
This unit is closed.
It's
but,
snapped up.
they're opening, well, I think you had 6 years to fill it up, you know, but
Yeah.
now they started another one, I think in Henrietta, so.
Oh, I don't like Henrietta.
I'm only guessing, I think it's Henrietta.
Is it?
Yeah.
I really like this. Do you like it?
Well, it was laid out by my wife and my daughter, but then my wife died before we moved in, so
Oh,
she
I'm
never got to
sorry.
live in it.
I
She
didn't
designed
know.
it. Yeah. Well, you know, it's funny, it's almost as much almost as much, floor space on one floor as we had in Fairport, two floors. This is 1630 something,
Wow.
and our house in Fairport was only 1820, so this is, it's big, you know?
It is.
For one, anyway.
Yeah.
But so it's wheelchair, wheelchair accessible, and I've
I'm
got an
glad.
office in there, used to be a bedroom, and so.
Good.
And next little workshop, I'm trying to build in the basement.
Are you?
Yeah.
Good for you. What do you like to do?
Mostly electronics, I'm a hand radio operator, so my radio's down there, and I've got electronic vents and touch vents and all that.
That's so cool. My neighbor across the street, he's not alive anymore, but he was a ham.
Yeah.
He was out on his roof fixing the antenna. Oh!
Yeah,
He
yes,
loved it though.
Yeah. Oh, yeah.
Oh my
I
gosh.
talked to guys outside of London last week.
Oh, isn't that so cool?
Well, the thing is, in the show way, they don't talk very long, you don't really get to know people. So,
True.
but you call, if you talk to somebody 2 or 3 times, then they start telling you, I'm outside of London, I do this, I do that. The first contact, they don't.
Oh, that's interesting.
Yeah.
Huh, very neat.
The thing is, I used to do everything Morse code,
Oh my gosh.
Well, I've kind of lost the ability now. I gotta stop and think. I can't go more than five words a minute.
That's so cool you did that.
Well, it used to be required for license. It's not even required anymore. So, I don't know why they dropped it. That's stupid.
Oh, that's interesting.
It's terrible.
I didn't know they dropped that.
Yeah, no one has to know the Morse code every time they license.
Wonder why.
I think maybe they got desperate for him, for a while.
That's probably true.
A lot of stuff. We used to do everything over. You buy the parts and you build it.
Yeah.
Nobody's doing that anymore. It used to be what they call a heat fit store, and they had all kinds of electronic,
Yeah.
kits that's gone, and there's Radio Shack, you can go and buy parts.
Oh, Radio
They're
Shack.
gone too. You can't even buy parts anymore.
No,
except
that's
online.
true. You're right.
So if you want to build something, you either know how to build it or go buy it, which is really sad.
Wow. Yeah, that is kind of. Wow. I hadn't thought about Radio Shack in forever.
Yeah, they're gone.
Wow. That was such a great store too, wasn't
Yeah, a
it?
lot of the things that you can buy stuff, you do it yourself, we're
Yeah.
gone. We're gone.
Yeah.
You can't go to the car zone that's 10 years anymore either.
They really do
Neither
not.
do the appliances.
Nothing does.
Yeah, that's the deal.
It literally was 10 years that my refrigerator gave up. It just started leaking all over the floor. I'm like, I'm not even gonna have, so I fixed the ice machine first broke, the ice maker.
Sure.
Like, okay, I'll get that fixed. It was $500 to fix it. Yep. And then about 6 months later, the whole thing just went. And I said, I'm just gonna buy a whole new one. I'm not gonna fix it.
I'm having trouble with the battery in my cell phone now, and I asked my son about it. He says, you can go to the store, they'll charge you $65 to change the battery and leave the rest 6 months.
Isn't it terrible?
Well, you can't, if you build a battery, special kind of battery for cell phone,
Yeah. Yep.
it's made for that cell phone. So once the cell phone stops selling, they stop making batteries, so you're getting old batteries out of stock.
Oh.
So, that's it.
Wow.
And they designed the cell phones to last about 5 years.
That's gotta be true. Yeah.
First to make them fail.
This one already has a virus. I mean, it just keeps doing
What kind of
weird
cell phone
things.
is it?
It's a Android, a Galaxy.
You could probably get some virus fighting software for it, but I don't know if it's worth it, but you could.
I know. I'm gonna investigate that tonight because all of my work things are on here, and they're all encrypted and everything. But I don't like the idea of it having a virus. I just don't like it.
Can you back up the phone? Can you ever back it up?
No. You know more than I do.
No, not really, but.
No, I don't
Is
know.
everything in the phone in here?
Yes.
Okay, so you can back this up.
Yes.
Okay.
Oh, I see what you're saying.
You
Yes.
can buy a little, what do you call it, external disk drive.
Oh, that's smart.
Yeah, someone with the 3 gigabytes, 3 terabytes now. You can actually put everything in there.
Oh, actually, I didn't even think about that. That's very smart.
Yeah, and then you can get the special software Staples installed for you that will scan your computer for you.
Really?
I don't know how,
It's Staples?
yeah.
Oh,
It can,
okay.
it can't protect you against viruses generated this morning, But it's better than
That's
nothing.
true.
You can go
Yeah.
in there and warn you, hey, this is a suspicious site,
I don't even know how they get your information and all that.
It's already out there.
It is, isn't it?
Yeah.
Did you know that? I have to tell you. So when I went to this job, we got a sign-on bonus, right? So
Yeah.
it was nice.
You like them? They treat you
I
nice?
do. They are good. Yeah. I mean, it's growing, so you feel the growing pains of that because it's new here, but it's not new. It was started in Chicago, and they've already they're 5 years into it now. But we're new here in
So that's some
Rochester.
benefits now.
Yeah.
Good.
So I got my bonus. I was so excited. That same day, I got a text message I thought from Chase Bank. It looked like Chase Bank. I know now, better know now. And it said, did you authorize $3,000? And I'm like, no. It said, hit yes or no, reply yes or no. Next thing I know, someone's calling me, representing the bank, but it wasn't the bank. My sign-on bonus I pretty much gave to this guy.
Well, if it only costs you $3,000, it's a good cheap lesson.
You know what?
Believe me.
You are right.
I almost lost $14,000. These guys are scamming me on the phone and I didn't know.
It's
They
terrible.
said, just go to an ATM and, we'll take care of it for you. I said, well, I'm gonna go to the bank. They said, no, don't go to the bank. What did you say?
Yep.
Go to the
Isn't it
ATM.
awful?
But the really bad thing was, they made me stand for a picture in front of my computer holding my driver's license. And now I have to call the New York State DMV every 6 months to make sure that they did it.
I was so
Well, until recently I tried to get my vehicle modified for, they were driving with a mechanic, but
Yeah.
it was.
right.
So I at least have a new driver's license now anyway, so they try to use my old driver's license as obsolete. So now I don't have to worry about it, but for a year I did.
Oh, that's awful. Isn't it awful? You know what? I tried taking. I was gonna try to. I found the person. I did major investigation,
Whoa,
but he lived in Florida, living a high life too. Let me tell you, beautiful home.
how'd you find the guy?
Yeah,
Yeah.
I know.
That's
I
cool.
found him. Well, because I did something really stupid. I wired money through Zelle, which is their, that's how you give people money through there. And he used a fake name, and I looked this person up on Facebook. I'm like, this is not the same person that called me. So then I did one of those reverse phone things,
Yeah.
and I eventually found this number.
What'd it cost you for the reversion?
Not much.
No?
Not much at all. Like, I don't know, $5 really? Not much. And then I canceled the subscription, because they make you subscribe to it first.
Sure.
But,
But it worked.
well, when I called him, I left a message and I said, listen, I know that you just, did this, and he changed his number.
Sure.
So then I couldn't, and he had an LLC. He was a consultant. Oh, yeah, you were a consultant, all right. Consultant. Right? So, yes.
I'll show you.
I know. I can't believe it. So anyway, I never did get it back, but he lived in Florida and there was nothing I could do.
Yeah, right.
Well, they said I could go down there and take him to small claims there. And by the time I get there, can't be bothered. So tell me, when did you have surgery? How long, is this new? Your prosthetic?
Well, I had my foot removed because, I think because of the COVID injection. Then, things were going very well. I had that prosthetic and it worked very well. I was outside walking along my cane talking to my neighbors.
Yeah.
Then I fell down and broke everything on the side. Broke the femur, broke the hip, broke everything. So now I got a big peg, I think is a foot long, titanium rod in there and some little screws.
Wow.
Anyway, so that's why I'm starting over again, basically. But that's all over basically the last 3 years. And so, and this leg's got problems with circulation, so the foot's kind of funny with it. So.
Okay. Listen, I want to tell you, I have a certification in wound care. So if you ever, need any suggestions of what should I do with this, or
Maybe I should look at it. But
absolutely,
do what you gotta do for
yeah. I also want to tell you, I think you go to, who do you go for podiatry to?
Oh,
Not Devasto.
yeah,
Is it Devasto? Yeah.
Right, Dr. Ray.
Yeah. So.
I'm gonna see him next week, I think.
Yeah, he's very good.
Yeah, he's not bad for all that.
Yeah, I know, he's been practicing for a long time.
I can't imagine him, but,
Yeah,
he's good, man.
yeah, he's very good. Yeah, so if you ever, I'll look at it, we can do whatever, you know.
Actually, I think it's certainly better than it was.
Good, good.
After I fell asleep, I sleep on the couch, I roll off the couch, this is real hard. So I almost broke my hip.
It is hard.
Anyway, so
Yeah.
they got me some sort of ultrasound for my leg, and they took x-rays in my foot.
Yep.
So I got lucky.
How, do you have follow with vascular? Who do you see?
Dr. Nix, or cardiologist, is Dr. Krishnamurthy.
Oh.
Krishnamurthy is my cardiologist, and Dr. Nix is my vascular surgeon.
Okay. Okay. Is that through U of R or?
So yes, I'm strong.
Okay, that's what I thought. Okay. All right.
They're not bad boys and girls.
No, they're okay, right? Well, you don't look your age. You know that? I just looked at you're 6'29", 43.
Yeah, what it is?
Wow.
Because of the Civil War.
Stop.
What?
You look good. You do.
I think for when they get died with no foot, whatever.
How are you managing now? Do you have any sores on that leg at all, or no?
This leg, all kinds of sores, that leg's better. Actually, it's just a stump over there.
Yeah.
It's in good shape.
Good.
No complaints, no nothing.
What is, I can always look at it, but do you know what your circulation is on this leg? Have you had any revascularization done?
Well, I asked them about the, what do you call it, what's the vascular cleanup process?
Yeah, an endarterectomy, yeah. I know what you're talking about.
I'm not a
Candidate.
candidate until my foot heals up. It looked like a piece of meat when I first fell down.
Wow.
And now it still looks kind of bad, but I went to the wound center and they fixed me up.
Oh, which wound center?
It's on,
probably.
Ridge Road, I think. No, where is the wound center? It's in Rochester, near where the expressway crosses Culver Road.
In Irondequoit?
Yes.
You didn't go to the one where it's part of St. Anne's? Didn't you go? No? I'm wondering where you went.
Well, it's in the U of R wound center.
Oh, it's U of R.
Yeah.
I know. So I just.
Interesting. When my foot started, anyway, I damaged my leg, damaged my foot.
Yeah.
My leg was all swollen. One day I had a huge blister was just on my foot. The next day the blister burst. Yeah, so whatever I call it. And so I went to my primary care physician.
Yeah.
Yeah, a lady there was very smart, specialist. She gave me all these things called Curad Zero pads.
Yep.
And I put those on there.
Mm-hmm.
And, the skin regrew. But then when I went to the urgent, the wound center, they said, you should have done that. They said, you should have just put this Lucerne cream on there. I said, what's wrong? They said, you got one, they should have been infected. So I went back to the website and looked at the Curad website, it says the zero form.
Yeah.
It doesn't say you can't use it for wounds. It sort of says it's a really better for burns.
I'm telling you something, Zero Farm is amazing.
Yeah.
We use it for so much.
Well, anyway, so I
So
thought,
much.
but the wound center people said I should have done that. I was very lucky. They're supposed to be a specialist. Anyway, so they said it worked for me. They said, well, you're just lucky. What?
No.
I've never been lucky.
No.
I should be dead 8 times.
You've gone through a lot, haven't you?
No, I mean, just bad luck.
Yeah,
Mostly,
really? Oh.
service. I must have made people annoyed or something because They put me in all kinds of positions where I should be dead.
Wow.
Getting shot at by your buddies, having your flamethrower fail on you.
Oh my God. What?
No, just, things go wrong. And,
Wow.
to the flamethrower, but I think there's one that they did. I guess they tried to want to see your panic, so I didn't panic.
You didn't?
Well, the flamethrower is no longer in service, but it's a canister of air
Yeah.
and a canister of fuel.
Yep.
So you turn it on,
Right.
it makes this nice flame, 30, 40 feet around.
Yep.
But when it runs out of fuel, what it does is this. And you're standing in front of it, and it's 10-foot flame in front of your face.
Oh my God.
So I started to back up, and the instructor says, don't bother to back up, fire this on your back. And I'm turning around, don't bother to turn around, fire, your friends can't help you. I guess they thought I started skiing, with little boys, and so I pulled on my band, I started whacking on it, and I fell out.
Oh wow.
I think I disappointed them.
That was so smart thinking.
No, it's just a blank panic.
Oh man, I would have. I don't know what I would have done.
Well, there's no time to really panic.
No, I guess not. Yeah, you have to kind of think of what am I going to do?
Like I remember one time where I'm standing in the squad bay and my drill instructor comes up to me and goes, your brother's at the hatch. So I go running to the door. I say, I'm not your brother. So open the door, here's this kid. My name is Joseph F. Foster.
Yeah.
This kid met me and he says, my name is Joseph F. Foster. Black kid. So he came all over the stage. He goes, oh, I'm your integrated Santa Claus. I started cackling. I fell on his back. I don't know what to do. And you hear the drill instructor going,
Oh my God.
Our force is okay. It was a good rating.
Oh.
They keep getting our records for 4 years.
Oh. Oh my God.
Yeah, really. I should have asked him what he's doing right now. I don't know exactly what I'm doing.
Oh. What's your middle name?
I ain't going to. What's up, Brady?
I love the way you
Franklin.
say it.
Yeah, Brady Franklin, they call me.
Oh my gosh.
Well, my grandma wanted to name me Elmer Sylvester, and my father's name was Clarence Elmer. So my dad told grandma to forget it. So the compromise is make us Franklin.
Oh my God.
And I don't talk to, I told you, I don't tell people that, because I don't want to
I understand. Well, listen, my brother's middle name, well, first of all, his name is Howard. Not a great, it's okay. Ready? Crookshank is his middle name.
That's a very classic name. That's a last name for some people.
But when we
There's
went,
lawyers named Crookshank.
you know what though, when we went to his college graduation, they said his whole full name, and I looked at my mom and I said, that's his middle name? Why'd you do that?
I had a little man said, what?
Oh, I never knew.
Oh.
He hated it though.
Oh,
He hated
I
it.
bet he grew up pretty tough too.
He did. Oh, people picked on him for it. Oh, yeah.
Sure.
Yep. Okay, let me ask you, have you had any recent hospitalizations?
No.
Good. Are you still going to the wound center now, or no?
What kind of,
Okay. Who is doing, do you have wound care? Are you doing it yourself,
I
or?
have, I go to my PCT if I need something,
Okay,
and, otherwise,
okay.
that would be you guys, I guess.
Yeah.
We used to have a nurse service, which is intense enough on Cara.
Yeah,
The girls used to come and do a very nice job, but
Okay.
the insurance company pulled it away.
I know. It's
I
terrible.
have no choice.
I
They
know.
would become,
And now they've, went with us.
yeah.
I used to work for Ankara too, so I understand. I know it's a business, but it's still,
You know that?
I knew they weren't doing well at the end. You could tell. And I was like, something's happening
Bad
here.
management or what?
Kinda, yeah. Well, with this company, Weldy, they have better metrics. They have better ways of keeping track of people.
Oh, understood.
Yeah, and Carl was kind of losing out on that. So of course the insurance company's like, we want to go with the one that's going to save us money.
Sure.
It's all about that. It's hard because you're taking care of people.
Yeah, people that come to me are always very clear, including me.
Yeah,
Which is really unusual these days.
I know. It
Also,
really
people that
is.
actually have to drive around and talk to people, that's kind of troublesome too. I'm glad you guys are willing to do it.
Of course, I enjoy it. This is so much better than the hospital. I couldn't go back to that. I worked in the emergency department for 10 years.
Oh my God.
Yeah.
You must have strong nerves.
Done with that. Done. I learned a lot.
Oh, I'm sure.
A lot. Yep.
You must have a good self-esteem.
Yeah.
You could have been a Marine.
You know what though? I wasn't like your typical. I cared probably too much. But I didn't like some of the nurses were very. They were cutthroat. They were. Man, I'm like, I'm not gonna be like that. I don't know. Yeah.
Take them up with a sussy up and put a parachute on and see that.
Exactly. Right.
Yahoo!
So you have a son here? Okay. Do you see him very often, or?
No, he lives in Pennsylvania. He comes over.
Pennsylvania.
Yeah,
Gotcha.
He comes up a couple months.
Okay.
My primary support is my daughter.
Oh, is she here in Rochester?
She's about 6 miles from here.
Oh, nice.
Yeah.
So she lives in Webster. Is it Webster still?
No, she lives in
Ontario. Yeah. Yeah. Oh, good. Good. Now, is she working or no? She
Yes.
can. Okay. All right. But she checks on ya.
Oh yeah. Checks on me, checks on me, make sure I don't spend any money.
Well, it's
But
funny.
basically, it's always good.
No, it's
My
true.
wife is doing this.
Yeah. How long has it been since your wife?
It's almost 4 years now.
So she never got to come in to here.
She
No.
resigned it, but she never got to live with it.
Aw, that's so was it sudden or had she been sick?
Well, she had a stroke 3 years ago,
Oh.
and this one came up real quick. And my wife and her, well, no, her two sisters, all
Oh,
passed
let me
in
see.
6 months of each other.
What? He did? Oh my gosh.
My wife was a pretty lady in a polka dot dress on the left.
Oh, she's beautiful.
Yeah, she was.
Wow. So pretty.
And she wasn't a bad person. Killer wasn't a bad girl.
Aw.
But
And are these her sisters here?
Yes,
They're no longer here anymore either?
all 4 of them were gone.
Oh my gosh.
All went within 6 months of each other. Well, their mother and the father both died. And,
Oh my god.
yeah. Well, they're together now.
Wow.
So that's it.
Life is crazy, isn't it? So do you have anybody else coming in to help you at all?
No, I'm Carol. What's she name? I'm Carol no longer comes here.
Yeah.
And one of you guys, the therapist, comes.
Okay. Alright.
He did it here.
Okay.
As far as my house, no one else right now.
Alright. And you're okay, like you can do your showering, your dressing, your meal prep?
I don't do any shopping myself. I don't cut the grass either. I can't even do it.
No.
So I go down and get outside and pull a couple weeds.
Okay.
A few degrees or some weather or whatever.
Yeah.
A whole lot.
Yeah. I see they put you on Prolia too, the
You
shop.
know, well, the reason I broke everything, you didn't realize it, but I lost osteoporosis. Men don't get that, right?
Can I tell you something?
Yeah.
They do, and you don't check for it. And it's
Nobody else did either.
really bad.
They were surprised after they saw me, it broke everything, my goddamn leg. And my hip, my femur and hip all cracked. And then they say, oh, you know, there's no problem with bone density there, right?
Yep. We totally are blindsided. We don't look at, oh, men might, oh, geez, they may have it too. But we just focus on women, osteoporosis, women, no estrogen.
You guys
It's
have the only
bad.
ones, nobody else did either.
It's,
I've had a, primary care decision my whole life.
yep. Never thought of it, right? Nope.
Yeah, you can determine that stuff by blood chemistry, now, you don't need that extra.
Oh, it's so easy. It's so easy to do.
Anyway,
I know.
I found out.
I know.
Well, they told me, look, if you do this again, your femur's gonna snap your, sever your femoral artery and you want to
Oh, God. Oh, that's, jeez. Thanks.
Well, you know, Sandy was my first study plan. We go to try to open a package. And whenever people tell me, whatever you do, don't fall asleep. Not only for study, whatever you do, don't fall asleep. Yeah. Anyway, my neighbors had to come and pick me up, put me back in my wheelchair.
Oh,
And I went to their hospital, in their high school.
God.
Yeah.
How are people here? Are they pretty
Well, the
nice?
thing is, they don't do a whole lot, so
Yeah.
they don't get to know very many of them. But, you know,
It's true.
they think I'm running a business here because I have people come every day with a no more. I got a lady that shops for me and drives for me. I got a lady that cleans my house. My daughter comes here twice a week. My workmates come here. My former neighbors come here. These people don't have any guests at all.
I know.
They think I'm running a business. I don't know.
But you're loved. They want to check on you.
Yeah, sometimes they think I'm really like I've got some of the former guys that used to work with them. They come over when they can. We go down the street and all for lunch.
Oh, I love it there.
Yeah, not bad.
Isn't it fun?
Yeah.
I like it.
Yeah.
Well, I like the people that work there. I mean, it's nice. I go there. I haven't been in a while, but I do like it. Where do you get medications delivered?
Yes, and white things,
Beautiful.
home delivery.
Beautiful. Does that work out okay?
So what?
Okay. How long have you been on the medicine for your heartburn? Pantoprazole.
Several years at least.
Yep. So
I
that.
didn't know that was for that. I forgot.
Yeah, no, that's okay. So that right there, that medication is something that can decrease your bone density right there.
Really?
We are not looking, yeah, but now thankfully you're on the Prolia, so that will keep you, Prolia has been an amazing medication invention.
Okay.
Yep.
Well, you are just me through chemistry.
Good. Perfect.
Doesn't hurt. People think so.
No, I get it too. I totally understand it, and I've done a lot of research on it, and it's good stuff.
Everybody told you about my therapist guy?
Yeah, he's here.
That's okay. I'll tell you to sit down and relax.
Oh, he's got a nice car. Yeah.
Actually, he's a senior guy, whatever it is, senior therapist or specialist, whatever you call it.
How long does he stay for?
I'll tell you what half an hour.
Half hour?
Yeah. Not
Okay.
That'll be so fun.
Alright. Well, I mean, I could, if he's, I can come back. That's
Anyway,
fine.
he's a guy that
Aw,
he's bigger than me, but they get a hold of him, I can hurt him.
Aw.
He's a good guy.
Yeah. Listen, can I take your blood pressure and everything? Well, does he do that too? Does he take your blood pressure and everything?
I can't remember, he's only been there once. I don't remember.
Alright, well, I'll tell him what it is. Maybe he'll take my readings.
Oh gosh, what have you done?
Look at all that!
Wow.
I got lots of stuff.
Just like that doesn't touch you in it anyway.
Oh, good.
He's a guy.
Good. I love it. Good. That's just like the way I want it. I don't. No. Okay. Did you ever smoke?
Yes.
You got some arthritis, huh? Yeah. Oh, your poor fingers. Let me see. Oh. You have pain?
No, all I was got skinny. Well, it hurt, yeah.
Yeah, you do. Yeah. Yeah.
Always do. So it could be worse.
So you quit though a while ago, I would think. You're smoking right good. Your oxygen's really good. Oh, good. Good. Is he smoking? Oh, let me get on the phone with him. Here. Yep. You have me come and I'll talk to him. Oh, they're so beautiful. They're so smart.
There's so many of these doggies, they rescue other doggies, they rescue other animals, they find them for.
Yeah, they're smart dogs, aren't they?
They're too smart.
Yeah, I know. Alright. No, you're good. You're fine. You're fine.
right.
Joe,
Hi, no, you're fine. You're fine.
Yvonne, this is Joe, Joe, this is Yvonne.
Hi.
Hi.
How are you?
I think we met before somewhere down
I
the.
feel like we have.
Yeah, we
too.
have somewhere. You're from.
Welby.
Yeah,
Yeah.
we met somewhere before.
I think we have.
Us old timers.
You were not old.
Yeah.
Yep.
Look what you got on.
You said get after those guys, and I did. And,
No, you're fine. Do you do blood pressure?
I do everything.
Oh, you do?
Also,
Okay.
lung auscultations, everything.
Ooh.
what'd you get?
I got 128 over 80.
We should try to get a weight on you too, even though well, I got to see how you stay. But you haven't been up in a while, so maybe next time, or maybe we can try it. I don't know. I mean, you got to take into account your prosthetic leg too. But I mean, if you're consistent with what you're doing, then maybe we'll get it accurate. I mean, you have hypertensive heart disease, but you don't have the heart failure part of it. So.
Well, I know.
Question, well, yeah.
Let's see my cardiologist and said, you know, we're going to have to talk about that valve pretty soon. Come and see me in 9 months.
Dr. Hishimoto.
This
You
is
did mine. I have a mini aortic valve replacement. I have it in the family. I went back to work in 4 weeks.
What?
That's
Wow.
That's Joe's tough guy.
Oh, it is.
Oh my God! Wow.
Thank you again, sir. Please have a seat for a minute.
I will. So we got it on. They got you right in, and
The mistake I was making with those poor bastards that designed these things is my leg wasn't shrunk.
No.
I put this rubber thing on,
yeah.
and I left on it overnight. And I went down there, and sure enough, my leg was the size. You told me about that. You said
Use your liner. Yeah, not because your shrinkers are there's nothing to them.
Adjustments yesterday. I was walking out of there.
And I'm wearing the silicone liner or the sleeve for it because it gave it more compression and getting up and elevating it and everything.
Yeah, that's what I did.
Look great. That's
I do those, the exercises, the squeezing. I do
Yeah, all those. So I gave him some exercises for venous return, some of the isometric contractions with his legs elevated above his heart.
Yeah.
Because that one was, do you still have any problems with those blisters on your foot?
Well, just that one little one. I see it.
Huh? Yeah, I want to see it too because it's important.
Yeah, I really want to see
Because
it.
if I need to have nursing come in here or something.
Well,
Because
I
we're
can
PTO.
arrange-
Yeah, I know
can
you can.
arrange
Yeah.
that. Yeah, if you know.
Yeah, let me get my gloves on. Let me wash my hands first and we'll do that. That's good. I'm glad you're here. That's really good timing actually.
This was good.
So it's good.
Yeah.
But she's getting an update on what, I've only seen him once. Yeah.
Oh,
And we couldn't get, he was so, his disc residual limb was so, they both were adenomous. We talked about watching sodium intake and things like that.
Yeah.
Elevating. I'd love to see you get another,
What?
a bigger chair. A nice, if you're sleeping in that chair,
I agree with
you should really think about an infinity chair like with a lift chair and just,
Ooh.
that would make you so much,
That would
we'll
be
talk about that.
nice. Yeah.
Question is, well, my daughter let me spend the money.
Well, as long as it's not mine, we're all set.
My son doesn't say much. He never argues with me about what I spend. My daughter.
No, I mean that's like getting good. I mean, if you're sleeping in that chair,
Yep.
you want to be able to at least get into almost a bed position with it.
It does, Joe. It goes almost like, when I use those pillows you showed me,
Yeah.
my leg is definitely higher than my
A
heart.
little small. I mean, it's you need a little bit more room, I think, because you can see how the chair is kind of. You can't move in it.
I'm deforming it somehow too.
We talked about. I mean, the other option is trying the bed with a bedside assist. I know you don't. You really.
Like, Joe, you wanted me to use this walker, I use a rollator. I'm just not comfortable with the walker. I can just see myself going crash.
Oh, you mean that one?
Yeah.
Have you been up walking?
Yeah, use the rollator.
You're welcome. You want a few of them? You want a
You sure? I got a whole box of them.
Mine are in the trunk. I just go back out here.
I trust you, I don't think.
I thought my fiance was here. She drives the same SUV.
Oh, you're kidding.
Yeah, same color and everything.
Oh, really, Ron was just saying that, the nice car you have. I said, yeah, that's when I grow up on that Ford Road.
Oh my gosh.
Oh, when I'm driving?
Yeah.
Yeah, well, that's not horrible. It's only about 38.
What?
My car.
Oh.
42 when all said and done. But that's.
When I grow up on that Ford Road?
Oh, and I got 15 staples in my arm right now.
Right. You do?
They removed the sebaceous cyst.
Oh, yeah, that's Those are not fun at all.
Looks.
Yeah, looks good. Looks good. Yep.
Look how much less adenomous you are, though.
Yeah.
Oh my God.
That looks
That's
good.
You have less fluid in your leg.
Oh, this thing here is
Looks a lot better.
No. Your skin is all intact there though, which is good.
Yeah, please, oh, you know what, I made a mistake, sir. You asked me the other day if you could loosen up the brakes a little bit. I said no.
Oh, I can loosen them up for you.
I'm saying the wrist couldn't lock up one of my brakes, so.
Do I have my, let me see if I have my socket set in
It
there.
doesn't have to be this time, though. I got sockets set downstairs.
Yeah, all I gotta do is loosen this up here and slide that forward a little bit. And it won't, it'll be less hard to engage.
We can do that whenever you have time, or maybe next time you do
Or
it.
we might have time today, who knows?
Looks really good. Do you want you want a little Band-Aid over it?
Here I got
I
one.
got one right there.
Oh, perfect, okay.
Yeah,
Yeah, of course.
this is how, first time I've met you guys.
Yeah, it's different, and you know, it's nice. I like it.
And I need bilateral knee replacements for the Lyme disease.
My son got it. My son's got it.
And I got an ORIF on my right ankle because I broke my ankle with a dog.
Oh, no.
Got Lyme disease, broke my ribs with a dog.
What is it, were you wrestling with a dog?
I know, what was going on?
Well, I was messing around with her outside with improper footwear on, down by the creek.
How big is the dog?
About 60 pounds. She's a half pit and half lab.
That's how I tore my meniscus by wearing
I tell you, I love. And now to do any type of
No, I was just walking.
Oh.
yeah, loved it. We did all these trails. I forgot my Lyme disease probably. All these trails in here.
Yeah.
My son
Yeah.
had it.
Loved it. My
I
favorite.
saw that his face fell down one day.
Oh, yeah, it's a Bell's palsy.
Yeah, they thought it was. but-
Could be from Lyme disease
He
too.
thinks he.
Oh, true.
Because his dogs have had ticks.
Oh yeah. I didn't even know when I just wasn't feeling good.
Thank you.
You're welcome. That-
Then tested positive with both of them.
Yeah. You're the type.
That's why I don't get on my knees anymore. I did that
No,
for
I
years,
know.
working with patients, and I would
You
look
know
up,
what?
why
It's
don't you get a pair of
kind of,
those knee pads? Why don't you do this? I'm like, it takes so much time.
that, it does, you're right, I know.
We're going a little bit, just a little bit.
Alright. Just go through and food, I got food downstairs.
I think I have mine. I'm gonna go look at my.
Like I said, you don't have to worry about this week if you don't have time.
No, well, it's a frequent thing that you're doing, so let's take care of it now. It's not like something you're doing once a,
As long
once
as
a
I have
week.
my gloves on, my rubber gloves, I wouldn't worry.
No,
What
I'll
are you
do it.
guys gonna do?
I'm gonna try to stand him and see what he does. So we're probably gonna go to the kitchen. We're probably gonna do it with a large surface that's stable, like the sink.
Okay,
Then we can move on to something.
alright.
So maybe we'll do that. Let me do your, well, actually, you know what? You did his vital signs at rest. I'll do them after we're done.
Okay.
How's that sound?
Sounds good.
Yeah, I don't know how good I recover, that's a question I don't know.
That's a good question. Mhm.
Recover from,
Let's say exercise, you know. Your heart.
you mean your heart rate and your, yeah. Well, you've got some cardiac stuff too.
Yeah.
Yeah, sure.
In your history, I know that.
Yeah.
You know, you got that non-rheumatic fever or something like that. Don't you have something? Yeah. I mean, your murmur's not peaking yet,
Well, I
but
went to see my cardiologist, and he did more acoustic testing than I've ever seen, must think I know.
did you mention Dr. Hisamato?
No,
Or you are medicine, right?
yeah.
Yeah, that's who he's in with Dr. Knight and those guys, you know.
Oh,
Dr. Knight, I think is, you know, he does the same one, but I think he might be kind of winding down a little bit.
I think you're right.
Yeah, I think Dr. Hisamato would be the way. He studied all in Japan.
I've been seeing Dr. Kristen Murphy for years, several years now.
Is that cardiologist or cardiothoracic surgeon?
He's a cardiologist.
Yeah. Dr. Hisamato is the cardiothoracic surgeon.
Oh, that's a specialty too.
Oh yeah, that's who's gonna be doing your valve. Oh, you're gonna have a TAVR though.
Yeah.
Who?
That's different. You're gonna have a different type. Yeah, you won't be getting Dr. Hassan. You'll be getting somebody else. They're a little bit different. They're what are they called?
Actually, Knight probably, he does a lot of them.
Does he do the
Yeah.
TAVRs? Well, Hisamato, maybe Hisamato
He
does.
does.
Well,
I bet
low
he
budget thing, what
does.
is it?
Yeah,
Because
I know Stuber does them too.
Yeah, usually you'll have the backup of your cardiologist
Yeah.
there.
Sounds like kind of a low budget thing.
Or.
No, it's less invasive.
No, stop.
They're gonna see. I couldn't do that because they have to replace mine first. So next one I can get in 10 years. Hopefully it makes it that long. Then they can do a TAVR.
So how did they do yours though?
right through this thing. They went right through my, you can feel right here. Right in here, that did it. And they went right through the rib area down. They cut the old one out, and then they sewed in the cowbell. So I was extubated within, was it half an hour? I was a little bit unusual though, because I'm very like, so, and I didn't want to lay in, that bed,
Yeah.
so I was in the Jerry recliner chair within the hour after I got up there.
Oh my God.
I don't picture you as being a good patient either.
No, I know.
And they gave me a nasty UTI until I got home. It didn't show its ugly head. I was only cath. He goes, we're gonna cath you during surgery when you're under.
Yeah.
And then he pulled it right out when I got up in the intensive care unit, and they still gave me a UTI.
Oh, yeah, they're not fun.
Yeah, I let it go. I thought it was gonna go away.
People used to say,
103.5 temperature. I was like,
Oh.
people used to say if you're not sick, go to the hospital.
things are different nowadays.
I didn't know.
All right. Now, can you hook your other foot, or do you want to go? Let's go right to the kitchen sink.
No, I want you.
She wants to watch you what you're gonna do.
Yeah.
That's why she was asking.
Is that all right with you?
Sure, no
I can
problem.
see? Okay.
That's why she was asking what we're gonna be doing.
Well, I just need you to sign a consent that I can come back here to see you. But we can do that.
You also sign my paperwork that I can communicate with your healthcare provider. So
Trust
there
me,
you
I
go.
trust both of you guys. Trust me. No question about it.
This is a nice bag you have. I like this.
That's the nurse's bag.
Yes,
Yeah.
I like.
Those are nice.
Mm-hmm.
The PTs usually carry all the new breed carry the backpacks and stuff.
I have to tell you the age here, but it's a leader in home care. Did you know that? I recommend.
I will have to let them
People
up.
always
Do
ask
you know
me-
Adrienne Mann?
I do.
Do you?
We work together.
I just got done working with
The
her.
emergency department together.
Yeah.
Years ago. Years ago.
Yeah, she just had it. Oh, where are you going, young man?
Wow.
I've been to dinner already.
Oh my
I did it yesterday.
That's not the area where I want you to go, but that's okay. I didn't think you were gonna fly up like that. Don't do anything. So I just want you to stand here. Can you sit back down just for a second?
You know, these things lock almost.
Yeah. Let me get these from underneath your legs. And
Looking for those things.
let's come around. Are you able to come through here, or is it
Sure.
kind of a tight fit if you were to face that
No,
sink?
that's fine.
And the lights that come overhead the island.
Right there, Joe.
Awesome.
First two.
Beautiful. That's good.
Oh, all right.
That's even better.
All right. So what do you want me to do?
Let's face the sink. I like the sink, and I like this area. A little bit more area to work.
All right.
I know turning this thing and facing it might be a
I'll
challenge.
get it. I'll do it.
Excellent. Don't go anywhere. I'm going to the other side.
Joe, where are you sleeping at night? Where are you
In
sleeping?
the chair.
It's not reclining.
Oh, okay.
No sores on your butt though, right? Your
That's
butt's
good,
pretty
yeah.
good. See, that's the thing too, we need to talk about. I've only seen him once.
Yeah.
We talked about the bed. He has a real fear about it. I said, I try to introduce a bedside assist for you, or at least trial one. I'll direct to see if the loan closet has one and bring one. Because that gives you that support and your ability where you are in bed at night. I showed him some pictures.
I don't want to go. Sorry.
All right.
I just, you
As
know.
long as your bottom's okay, I would really consider maybe getting a little bit bigger of a chair and maybe an infinity one.
What's it?
It goes right out into a bed like.
Really?
Yeah. Oh, yeah, they're really nice.
I just think that I've enough room to use one.
Oh, yeah.
Oh, yeah.
Really?
It's just got different positions on it.
I'll write that down.
I'll write down for you.
Yeah. Yeah.
Joe handwrites all of his instructions. So I got it. That's handy.
Aw, that's
You can't carry a
that's so
computer.
nice.
I'm not an outstation where I can go on the home, HEP and print off everything.
So,
I hate them.
anyway, he prints everything so even I can read it. It's good
Oh,
stuff.
that's nice. That's really nice.
Anyway, what do you want me to do?
Okay, now, all I want you to do, I'm gonna turn this chair just a little bit. Get an even stance with your feet, just about shoulder width. Good. And then what I want you to do is lift this right hand, come down to your side, and let it come down. Now, are you able to straighten? You gotta work on some hamstring lengthening too. That's very important for walking. Good. Now, that's what I want to see.
I do think balance problem of some sort.
Well, of course you do.
Makes me nervous.
Yeah. Well, I'm right there with you, so, but this is interesting, this is good. Okay, back on. Bring your left foot closer to your right. All I want to do, we're going to do what's called a clock step. It's actually, you're going to do a side step first, and you're going to do it with the left leg. Well, hold on, wait for me. That's where things happen. Okay, take one step out to the side with the left leg, good, and then back over. Now see if you can pick it up a little bit more from the floor and step out to the left. Yeah. Small step, and back over. One more. And again, this is where the wearing time, if you haven't done this in a while, comes back because of this type of stuff. Now you're putting more pressure through that, to get this, the end of your stump. Yeah, we're gonna work on that. I'm gonna show you something to do today. Okay, let's sit back. Let's reach back and sit. Yeah, reach back. All right, let's try to walk since you're here. You know what? They cover it.
You do?
I don't know. Now, did you get that chair through the insurance? Or not? Yeah. I like, I mean, you're gonna get a big, I mean, I don't know if you can get a Rojo.
Oh, I love that. That's
But
nice.
I'm thinking, not like a low profile, even the Mosaic, they're about $100. They're the lower end of the,
What is it?
they're fluid-filled cylinders.
Yep.
In this one, they're a little bit bigger, they're not like little fingers on
What do
it.
they do?
Let me
Pressure
show you.
relief
Yeah.
on your
For your
butt.
bottom when you're on the chair.
Well, somewhere I had any trouble with maybe, you know.
Yeah, you're pretty good, because you're pretty active, you're able to unload your bottom, that's the thing.
Okay.
But I'm thinking even in the long run, if you're sleeping in that chair,
Yeah.
would probably be, let me get on my tape measure. You have a card?
I do.
Awesome, I'm gonna take one from you, if you don't mind.
No, I don't mind at all. I know, these are.
Yeah, it's not the higher end, typically insurance doesn't cover it. Don't look at my kitty treats, I gotta get them out of there before I get my bag, before our,
What are you doing kids
Thank you.
treats, Joe?
I give me the kitties, and the dogs like them too.
You do? Oh, yeah.
So depending on the size chair you're gonna get though, that's the thing. I mean, I can have somebody from West Side come out and talk to you about the chairs, or you can go to West Side. My recommendation is to go and try the chairs out.
Where are they?
Right in Henrietta Town Line Road is one. Yeah. I'd stay away from Fonte's.
Yeah.
I like Matt, the Garvey, he does my wheels, but I'm not going to them anymore. I just had a whole thing on a Hoyer lift, a whole episode before I finally got the answer that it was going to be covered by the insurance. Then they wanted, this is for a Hoyer lift, semi-electric, $3,155 up front. I said, you know, I can buy 3 of those online for that. I said, you crazy? And she goes, I don't even know when it's going to be in though, but we need that money up front. I said, thank you. Don't order it.
Yeah.
Yeah.
Wow. Isn't that?
Yeah, so this is 18.
That's terrible.
Yeah. 18 by 16. So 18 width by 16 is the size you would need for that. I mean, that one would be just, I mean, if you want to, if you can get one for the insurance
I'm gonna try.
for that one, 18 by 16, would be good. For this one, it's going to depend, I might get a bigger one, but we'll let that go for now. But for the wheelchair, I think it would be good. It doesn't have anything, you know, you don't have any pressure wounds, any problems right now, so whatever we can get, we can get. Just fine for that one. You'll feel more comfortable.
You say so, Joe. I don't.
Yeah, let's do it. We can do it right now.
I don't even know what it looks like, so.
Yeah, she just did, in Whitback did her surgery, organ.
Oh, really?
Get all the hardware out, and some missing leg, and some myotonic. She's doing good. It's not really affecting her. Yeah, she's an ambulance. I think I discharged her yesterday, and we were doing a half a mile.
Oh, awesome.
So she's doing good.
Good. Oh, good. Good. I'm glad. Yeah, that's rough.
How do you guys, because there's so many of these coming through, how do you guys You guys are through the insurance, right?
Yeah.
Interesting. So you work along, are you his primary or work along with the primary? I know, it's a crazy, you guys are great, because everybody who I've run into, you guys seem to, do great.
So,
Yeah.
I've never worked with a more caring group ever, and I've done this for so
So
long.
what level of people do you hire and stuff like that? Do you have PTs too,
No,
or
I wish I
just for
I'm
assessments?
really hoping.
Well, I'm gonna give you my card.
They really need to branch out. They really do.
They should, because
Oh,
we do home,
absolutely.
the safety assessments and everything else.
No. Yeah, I think they will, because the company started in Chicago and they do everything.
And I'm
So
on the,
I
yeah,
think that's probably.
I'm on the cardiopulmonary team, I
you're
manage your
awesome.
heart failure, we
You're
do
awesome.
everything.
Oh, perfect, good. Yeah.
I know you from somewhere,
I know.
Did you work at General back in the
I
day?
did.
Maybe
We
that's
worked
it.
together at General.
They used to call me PT Joe,
Yeah, that's where we are.
and then, yeah.
I was in the emergency department.
Yeah, maybe, and I used to come down once in a while.
ICU for a little while, and then 51, 52.
With Margaret,
Oh, yeah. Oh, God.
and then Stefan,
Yep.
because I took care of Dr. Malinov. I don't know if you remember him when he was there.
Yes. Oh,
I
my
tried to get him
God.
over to Kessler Institute, and I followed him onto that floor from the SICU. So I used to be the main PT in the SICU.
Yeah. I remember you. Oh, my God. When did you leave there?
Long time ago.
I
Let's
know,
see.
me too.
2000. I've been with HCR over 20 years.
Wow.
Yeah.
I noticed they're looking for an educator at HCR. Like,
There you go.
Yeah, that's kind of my gig, but it's okay. I like what I'm doing too here.
You know Chris Trementi?
Chris Johnson, yeah.
Yeah, all them are all involved. He's in, yeah.
Wow. It's a good place to work, isn't it?
Yes. Now, every place has its ups and downs.
I know.
And I stuck it out. I mean, there were some times where just like, you know what?
Yeah, where you're like,
I'm out of here.
Yeah.
But you know
I
what?
know.
Now I'm 61.
I know. I'm kind of looking for that.
We're gonna get a little bit more of an open space here. I'm gonna try to take a few steps so we can have a little wheelchair follow here.
Yeah,
Good.
here, tell me if you want to help.
Let's go this way. And you want to try your rollator, right?
Sure.
Or you don't care which one?
You want your rollator?
Yeah. Oh my God! We're gonna adjust these before I leave. It's crazy. That one's not too bad.
Like I say, the nurses, that's all, I don't know what the,
It's a nice one.
It is a nice one.
Oh, jeez.
very expensive, $200 each time.
It's probably 300 now.
Yeah, well, this is a year and a half.
Good job.
Take it again. Okay, stand for a second. Get your bearings. Don't go anywhere. I'm just gonna unlock this. So you're gonna lead in with your right leg first. Small step. You're an animal.
Doesn't hurt much.
And the last time you wore that prosthetic leg was what, several months ago, right?
Yes, well, I tried a couple times more recently, but.
You couldn't get it on.
Yeah, so,
Is this the first day you've had it on?
and then this week.
Okay. Did you try walking or no?
Yeah, I didn't have much luck, but what I did is I left it on all day.
That's what you gotta be careful of. And we're gonna take it off after because I wanna see what your skin looks like after. That's important. You wanna get a wearing, especially when you're starting to weight bear like this, you want a wearing protocol. Because you haven't been in it. So the tissue, what happens with the tissue, it gets not devitalized, but it needs to feel that pressure again. And it hasn't. And plus if you're carrying a little fluid in there too.
Yeah, it's been a while, too.
So did they make any adjustments on the socket or not?
Sure did.
Okay, good.
Like I said.
On both of them?
No, only the one. Oh, what I did, Joe, is I was complaining about the fact that this thing is binding me up here. So they cut this thing maybe an inch and a half shorter roughly. And now I can get it on completely without it punching up on me.
And when you stopped walking, when you were walking before, were you using the walker or were you using a cane?
I got to where I could use a cane, And I could go outside and talk to the neighbors down the street.
Okay, how long ago was the cane?
That's maybe a year now. And you guys, at least,
All right, how about to the dining room table? Just take your time. Yep. Now, when you're walking, work on spending just a little bit more time on that right leg. So take a step, and then step through. Good. Yeah, just take a little bit smaller of a step on the right leg, so you can reciprocate that gait pattern. Doing fantastic. Doing fantastic. Hey, not bad at all. All right, locker. Chair's coming up behind you. You're gonna feel it with the back of your leg, and then reach back and sit. That makes my Friday.
Yeah.
It really does.
Yeah.
And you did all the recommendations I asked you to do. It
Was
looks
it part of the writing? Yeah.
good.
So I'm gonna continue doing those before you come in and leave it.
Okay, let's take this later. Yeah, did you tell them about that?
Yes, I did. They didn't say anything about it.
Came out pretty good.
It's easier for you than for me.
Well, because of the position I'm in. Okay, good. You can take that off, and I'll roll that other one out.
See the cut it shorter for me?
Oh, yeah. Okay. Did you bring both of them, or just the one?
I brought them both for the only one to work on one.
Okay, just see how it went before cutting out the minutes.
No, I'm sorry, I didn't bring the other one, I just brought both aesthetics, but they only wanted to work on this one.
Oh.
The bottom doesn't
Oh my
even
gosh,
have
that looks
that
great.
fitting,
That looks so good.
Better.
Good.
That's
but-
it.
Oh, good.
What is that?
They
Hang on, we got another wound.
scratched it.
Inner thigh.
They scratched it and
Hang on, you get a very close.
I scratched it and it did. But it's not bleeding now, so.
When did you do that? How long?
2 days ago.
2 days ago. Okay. It was no scratch.
Yeah, I just scratched it with my fingernail, basically. So, it's instant, so it's very good. Too bad. Sorry.
You're doing good. You're doing great.
I got good help. He's really well, I can't lose.
You're making our heads too big.
I know it.
It's good on a Friday, though.
I'm really lucky to have people help me, not just the therapist, but also the nurses, the surgeons.
It's good to hear, because it's hard, sometimes you don't hear that now.
I'm so glad to hear that. No,
Well,
you're right.
you look at the amount of surgery I've had in my God in the body, it must be pretty good, right? So, you know what I'm saying, if they weren't all good, I'd be doing something wrong.
Well, true.
Well, still,
Yeah, are you putting anything on that?
just a minute.
Okay. Do you have a
Like,
little,
anti.
yeah, Bacterin or polysporin, anything like
I've
that?
got Eucerin, yeah. I've got Eucerin.
No. How about like an antibiotic cream?
No, I don't think it's like that. What's it called?
Like
Like a polysporin.
yeah, Bacterin or anything like that?
Yeah, Bacterin, yeah.
That stuff works pretty well. That's what I'm putting on my staples.
Okay.
Wait, let me.
Are they gonna take this thing while you're on? or-
Wednesday. And then I gotta take off a couple days, so I'll probably only see you once next week.
I know it's good for you, very glad that you're trying.
Yeah, let's work on stretching that leg out a little bit. I think that's important.
Yeah, I can feel it fine, yeah, you're right. I think I remember a stretch.
How about a dermatologist, Mike Brown? You know that name?
Brown?
Oh my God, he's the one that took out that gland or that cyst.
Oh.
79 years old.
Oh my gosh. Hey.
Over
that's awesome.
at Hellendale.
Oh yeah.
Man, what a gig!
I
What a
know
gig
that.
they have over there! Holy moly!
Oh my gosh, did you see like all the,
Beautiful.
it's like you're going into a museum.
It really is.
It is
And
really
they got like
nice.
7 PAs there and stuff. And
Look at
she's
you.
cranking it. The woman who owns it, right? I think.
Yes. Oh, I forgot her name now, but she's
He
doing
was a
quite,
character.
she's doing quite well.
This guy, he was like.
They took, yeah, I had a basal cell they removed last year.
Pull your
Did a great job.
oh, guys, here. So let's do this. Let's transfer back into your chair over there. I don't want to, there's a couple different ways we can attack that. And I don't want to, I just want to do it this way, I think. So what I'm going to do is I'm going to have you transfer back into the recliner chair without the prosthesis on, obviously. And then we'll go from there.
Should we put the sleeve back on, Joe, or not?
No, not right now. Yeah, we do a lot of documentation on this. That's what I'm doing on my own. Crazy. And we have what we have on this. So here's all the vitals that I'll put in here. So when my vitals are in here, so what I can do is go back here to vital sign history, and I can see everyone's other visits and what they did. What they took. We also have,
There's nothing out there but empty space.
so this is all his, his diabetic, his respiratory. He's good. I'm not worried about him. He's good up here.
You can
Yeah, so I've done everything I can in here, so medication reviews, if we, when med reconciliation, if we need to do something. Generator orders, if I called you and said, hey, I want to extend Joe's therapy, on the orders, we write it here, it's citing our orders right now.
Do you know what that's
Is this home base? Yeah, I think so, hang on.
Okay.
Point care.
Now, do they give you a phone?
Yeah, you can also get a tablet if you wanted a tablet. But the thing, when you get a tablet, you get a flip phone. This I like better because if I'm in here, right? So if I'm in here and I don't like something with your vital signs, I just go up in medical records, put demographics, get the physician, call the physician, and go back and forth, and I can skip through. Isn't that nice? And then here, this is something that's fairly new. This is Worldview. Have you heard of Worldview?
No.
What kind of phone is it?
I'll show you this. You got time?
Yeah, it's cool, yeah.
What kind of phone is it?
Oh, that's just the Galaxy. That's an old one, too. So if I wanted to take, say, a picture of a wound, right?
Yep.
So I'd go in here.
Okay.
I'd go into Worldview.
Ladies and gentlemen, please calm down. Please listen to me.
I know. There's so much.
I want to tell you what's going on with the ship.
Oh, come on.
Thank you. We've been thrown off course just a tad. What exactly is a tad? In space terms, that's about
So we can do our documents. If you wanted to upload a document to his chart, say like his AA, his insurance and everything, his health proxy, anything like that, it'll upload to attachments and it attaches to his chart. So if I wanted to do a wound photo, go in here, right?
Not exactly. We're also out of coffee.
So there's Joseph Foster. I go in here. I add a wound photo.
Oh, that's so
Now, here's the
nice.
big thing. This one automatically measures the wound.
Oh,
It won't do depth, but it automatically measures. So if I took, take a little wound there. Just like that again, Joe. It's not there.
Yeah.
There's a little blue dot, the stickers we have, that we
Yes.
have to put next to that, so
Okay.
it hones it in.
Oh, that's so cool.
And then what we do is we take a picture of it, and that's
Uh-huh.
going to tell me there's no marker. Take a picture,
Yeah.
say okay. That comes up,
Okay.
okay?
Yep.
I'll put continue, depth value is required, can't do it, so continue, go back, depth, not accessible, apply, continue. See that? So, if there was, what happens is, all these little dots come up here, and you can hone in that wound, and it'll measure it
Oh,
for it.
that's so cool.
So it measures it, you can make
Wow.
comment, and then that would upload it.
That is so nice.
That's Worldview,
Yeah, I never heard of that.
So this way, we can monitor, and other clinicians can see, is the wound healing, not wound healing? And of course, we got this because I'm sure there was liability issue somewhere down the road to where, so, but it's great. and it uploads the picture right to your chart.
So what is the world used for? Is it for medical stuff or for
Yes, it's
anybody?
for, well, it could be for anything, actually, yeah.
But it
We're
could-
using it for medical and documents.
But it dimensions things.
It measures your wound, your width and your length, not the depth. It can't do
Well,
depth.
they probably measure anything really, right?
Yeah.
That's
crazy.
cool, isn't
Is
it?
it- What do they charge you for that?
I don't know, I don't pay for it.
Oh, okay.
They put this on my phone.
Oh, well, I gotta remember that. Thank
All right, let's elevate your legs. So we're gonna put your legs up. So just a leg rest, so you're sitting. And then I'm gonna grab something from you.
you.
Like,
Ladies do.
okay.
But if you're grabbing yourself, before, okay.
I'm not grabbing anything. Okay.
I got nobody to grab.
All right, we'll be grabbing you.
Nobody grabs me, I ain't somebody wants to grab.
So here, now roll your knee inward. Just roll your whole head. Good. And then hold it there. Is that pulling your hip at all? Yeah. Now, what happens when you tighten your thigh? Now, good. But hold it 5 seconds. Push down again. Got it. But I want a little bolster underneath that knee, because I want you to bridge that a little bit.
I got a big round before.
We were using this to block your head, weren't we? So it didn't externally rotate. Okay. I'm gonna throw it in the garbage in a few minutes. And I'm gonna wash my hands afterwards. Well, that's good to know. I'm gonna let the higher above know that what you think of our rehab department. That's good information.
Well, not only do I, we all do.
Okay,
Like,
that's-
it's very well known in our office. And most places, like Rochester Regional, most other places that we fax these to, they say, we don't have staff.
No, I see those on the referrals that come, that we don't have staff.
They just say,
You know, sometimes it's like a circle between the 3 home care agencies. You know, when we're done with one, let's see if we can get more services when it's a game.
Yeah, that's a basic human thing.
Oh yeah,
Yeah,
gotta
you're
see what they
right.
can do. 'Cause I come in and I'll see home exercise programs on the refrigerator, and I'm like, did you just have home care in here? Oh yeah, the doctor ordered it again now. And we have to go by Medicare guidelines. You know, we have to have a skilled purpose to be here, or we can't be in here. And they look at our charts, and when they don't agree with it, they take everything away. They'll take the whole episode back.
yep, that's very true.
All right, now try it. Go knee in, and then just push the knee again. Tighten the quad muscle. There you go. Do you feel that back here? Okay, it's okay. Good. Hold it 5 seconds, and then relax. And try that 10 times. Hold it. 1, 1,000, 2, 3, 4, 5. Excellent. And 1, 1,000, 2, 3, 4, 5. 5. Try it 3 more. I'm going to add this to the protocol. 1, 2, 3, 5. Just do one more. Okay, just relax for a second.
Here, do you mind just real quick, just so that I can come and see you? All you have to do is really, it's just a signature.
Oh yeah, every time we see him come on,
I'm like, this
there's
is
Mom.
they'd say, aw, so it is. It is probably her. Okay, just all you have to do is just take the pad of your finger. Yeah,
It's like my phone. So he signs out on my phone.
Yeah. Perfect. It's perfect. That's just like the doctor's.
This is Nelly.
It's perfect.
There's Nelly. That's my dog.
Oh! Wow, who did that tattoo? That's beautiful.
That was his first portrait he ever did. I was in him with 4
Wow.
hours. He goes, you know what?
That's
I said, yeah, it's your
gorgeous.
first portrait. I can just tell because he got special stencil stuff. He got all sorts of
Yeah.
special stuff. I said 12 hours for that.
Nice.
It's a different type of, it's weird.
Yeah, it
It
is.
almost, it's almost like your body, your nervous system, after being there like 10, 8 hours getting that done, it almost starts to go in that, not shock, it's just it's like a weird
It's
feeling.
so
Isn't it weird?
right.
Well, it's a pinprick, right?
Pardon me?
It's a pinprick.
Oh yeah, well I got tons of stuff all the way down
Oh.
back in my day. That's the whole koi evolution. That's where he took some of my tattoo out when he cut my cyst out. I don't care, I don't get my shirt off anymore like I used to. It's, you know. Well, when I got all this stuff, Jet over at Love Hate Tattoo started, and Joe over at White Tiger goes, I really want to start all the way up here and come down. I said, we can't do that. At that time, I couldn't do it. Now you can. Now it's more acceptable. But, you know, I'm kind of glad. And I told my son, so I have 2 boys. One, the older one, I can't wait, I'm going to get a tattoo. It's always talk. The younger one, though, when he was 18, he was ready to roll. And then, right here, big tiger, big lion on his chest.
Yeah.
Now he's got a Celtic, some type of thing here. He's got a,
Yeah. Yeah, my dog's got a full sleeve.
yeah. The younger one's taking the sheriff's test tomorrow.
Whoa, wow.
Nice job.
He's a big kid. He's in great
You ain't
shape.
no peanut yourself, though,
I used to be in good shape. Now I'm just an old washed up hag. That's what happened. My fiance that I met 13 years ago, I was in the best shape of my life. I said, you know what? She just lost 58 pounds, 60 pounds.
Oh, the hell does she do
Wow.
On the injections.
Oh,
And she looks fantastic, right?
Wow.
I said, listen, you got me fat. You started feeding me dinner, and look at you, now you're skinny, and I'm a fat man.
you are not.
Okay, now roll that knee in again. I'm gonna take a little bit of one measurement on this.
You are not. Trust me, I'm fat. You know what that is. Well, you're very short of these things.
Yeah, I'm sure you want it straight before that. Let's turn this knee in just a little bit. You wanna put the prosthesis back on?
I will before you, what do you need, Owen?
Okay, I'm gonna go get my socket set. I'm gonna add that exercise. The other one I wanna add is a straight leg raise. So what you're gonna do is, can you bend that knee just a little bit? Or the top, okay. You can leave it down, keep it flexing.
Actually, I have no problem.
Yes. Now tighten the thigh. And then lift the leg up. Good. Bring it back down. Relax it. I want you to try 10 of those. Tighten. And lift. And you can do both. You can alternate. What's good for one side is good for the other.
Oh, really? All right.
You've got tight hamstrings on this side too. Tighten the thigh.
I'm sure.
And the thing of it is, when you sleep in this chair,
Yep.
that's the thing, you don't go into full extension, your hips or your knees. And then we start getting a little bit bent. And then we start losing tissue length. So that's the other thing. I'd love to see you get back in your bed. I'm going to bring a bedside assist one time with me and we can try it. You may, talking about it and doing it are 2 different stories. It's nothing I'm welding into your house. It's nothing I'm going to make you do, Joe. If you don't like it, then, you know, I'll take it back with me. But I'll try to
I
swing
think
back a
I
little
can
bit.
actually get a recliner that's like a bed.
Mhm.
Well, something like that costs, Joe.
Oh, you're probably looking at a couple grand maybe.
That's the height of my tooth.
I mean, you can go on Marketplace, whatever it's called. What's it called? Marketplace? Where they sell everything.
Market.
But then you're dealing with someone else's stuff. But sometimes you find stuff brand new on there. You know, people didn't get a chance to use it because.
The thing is, if it comes to me, I wouldn't know it's good or bad. You should look at it. I mean, I would.
No, I would recommend that your daughter take you to the place and actually try them out and actually listen to what they have to say versus someone coming here and just measuring up and doing it because all the bottles are sitting on a big showroom.
Joe, just write down for me the address and that place and
I'm going to look at a couple. I'm going to adjust her chair.
Right, John, glad to have you.
Lift.
Barb, thank you very much.
Infinity lift
Nice to
chair.
meet you.
I'll call you, all right? I'll call you and
Appreciate it.
we'll continue,
Yes, ma'am.
all right?
Thank you.
Pleasure meeting you.
You
Enjoy
too.
your weekend.
Well, it was good to see you again.
Yeah, I know.
How about
As soon as I
that?
saw you, I know. I know
Yeah.
you from
Have
somewhere.
a nice weekend.
Thank you, you too.
So you can kind of slide to these, and look at Rayburn Flanagan has one for about $1
That's
grand.
where I got this one from. But they didn't tell me anything about having a bed.
This one's a zero gravity, which these are designed, they actually tilt in space, like a tilt in space wheelchair, right? So that would actually take all the pressure off your leg. You see how it, oops, okay, you see how that actually, you see how that actually, it looks like a normal chair. That'll actually lift you up like that too, lift you like this. It looks like a normal chair. It looks like a normal chair when it's down in this position.
Zero G lift chair, all right.
All right, be right back.
There you go, thanks.
Yeah, we read you, Mayflower. Identify yourself.
Well, this is Elaine Dickinson. I'm 5'8", 123 pounds. I have brown hair, blue eyes. I enjoy surfing, backgammon, and men who aren't afraid to cry.
Will somebody please tell me what in Sam Hill a woman is doing up there in charge of that ship? Well, maybe she's got her ship together.
So I'm trying to send myself the link for this thing.
I'll send it to you.
Okay.
And I'll just write down infinity. If you type in, and I'll write it down, infinity lift chair.
Okay, George, what do I do with my phone? What, okay, just write it down for me, I'll do it with my phone when you go.
Okay, where's your phone?
It's an interrogative statement.
But it doesn't matter, I don't need to talk to
But that's not important right now, mister. Is my dog
I got it.
No,
Oh.
that's a spare.
Okay, it's plugged in. This one's plugged in. There's two of them over here.
Yeah, they're both spares.
You got burner phones?
I'll find it. Like, for instance, what I do is I make videos and phones and upload them.
All right, that's the hard one.
Okay, let me see what you do. What are you doing that for? You can get your own tool.
Oh yeah.
Fucking go, I tell you. Think about a man of many talents. Damn.
Yeah, you gotta be.
Yeah, that's a complete set of sockets. That's
Uh huh. Stay there. I'm gonna get that off of there because I got a funny feeling that is probably gonna hit the floor.
That would be 52 pickup plus 50.
Oh, here it is. Elaine Dickinson. She's a ship's computer officer. Jacobs, what have you got on Elaine Dickinson? Well, just taller, a better dancer, and much more fun to be with.
You sure you're not a mechanical engineer part-time?
No. Oh, I'd be a horrible. My dad died when I was young, but and that's, I always think about that. My kids would be better for if I had some type. Now my stepfather was quite the woodworker,
Yep.
quite anything, but he was an educator. He was chairman of the education department at Oswego College.
Oh, shit.
But man, the wood shop I have down in my basement that I bought my siblings out of the house that I grew up in. I bought the house after he passed away. We took care of him at home until he passed. He was almost 97.
No kidding. Wow.
I have a grizzly vac system that goes into my garage. So the power, it's unbelievable what he has.
97. So he did better than most of us had to use, that's for sure.
Yeah. Wow.
These floors actually attract stuff like that. Attracted me and it broke my hip and my finger.
Oh, Jesus.
Probably metric.
Yeah.
And knowing my family and I are protected with CarShield, because as a wife, mother, grandmother, and business owner, I don't have time for a car breakdown, and neither should you.
I know I had the one that said. What is it? That's it. It should be it right
Your
here.
days include running errands, a road trip, or work, you're driving there. And thanks to CarShield,
Ah,
we can get
this
to
is
and
it.
from
Is it?
wherever we need to be
Yeah.
with money saved
parts and repairs. Call CarShield now before it's too late. Call 800-708-0636.
I mean, working for you, Joe?
800-708-0636.
I mean, working, while you're adjusting it?
No, I'm good, thank you.
With painful feet and legs, taking medication just masks the problem. The answer is the revolutionary Flow, the incredible new medical device that delivers a new effective therapy for foot and leg pain. Now you can hit pain where it hurts and get your legs and feet feeling years younger. Thanks to Flow's advanced technology, simply place your feet on the pads, choose the level of intensity with the handy remote, then sit back and relax as Flow goes to work.
Flow has put me back on my feet again for over 12 hours a day.
I love Flow because it's taking my pain away.
My legs haven't felt this good in years.
Flow provides energizing relief, boosting your legs' blood circulation and your mobility. The secret is stimulating circulation with variable intensity levels.
Poor circulation leads to soreness, numbness, and pain. My patients using Flow are finally getting relief. They're up, moving, and enjoying.
This one seems to be okay.
First time that I used Flow, I didn't have any
If not, I can adjust them.
I'm a professional sports so I've been able to do the things that I really, really love to do.
Give your legs a boost and finally get moving again with soothing stimulation. The FDA-cleared Flow helps you reduce pain, swelling, muscle cramps, and boost your circulation. No awkward exercises, no crazy pedaling. It's cordless and portable, so you can get relief anywhere.
One thing about wearing the sneakers is,
Recline with Flow.
it makes my little willy gig seem hard to do.
Million happy users.
No, I can do it.
Yeah, I know.
5-star reviews with an amazing 90% of users feeling pain.
See now that lift chair, so the mechanism in that lift chair, you would be able to bring that up just a little bit and take that difficulty out of it. You can almost look at level to that. All right, disengage and engage. I can adjust it still.
Today, and you'll also get arthro pads for targeted pain relief on your knees. Absolutely free. Order now.
Are you sure?
I press the thing every time. You know, when I move.
Right. You were having trouble with it engaging though, right? It was hard.
Yeah.
Right, again.
Yeah, hard for the nurses and not for, you know, I had to work at it pretty hard. Nurses couldn't do it.
Good now?
Outstanding, sir. So what did I do that, the silicone sleeve? Oh, there it is, okay. I like to heat it up before I put it on, when it's cold, it kind of hurts.
Do you have a stand for this?
No.
You should. I think they have a stand for these guys, so they don't get dirty and stuff like that.
Actually, so what I do is I wash it every day.
Yeah, you wash it down with like a soapy water.
Well, what I use is, right now, I'm using, antibiotic soap.
All right, Jojo, I'm gonna write on here.
Except this time I know exactly what I'm
You know, sir, you can do whatever you want.
That's right, right there. Computer.
These things are totally useless.
I'm trying to figure out what tool they use to cut this, silicone sleeve.
Yeah?
Sure,
It was
sure.
probably paramedic. Was it a paramedical?
Must have been, it certainly wasn't scissors, I'll tell you that. Cut perfectly like this.
Joe, can I borrow a pen? I lost mine.
Yes, sir.
I just wanted, because I have one, but it's a Sharpie, and I don't wanna.
Yeah, there should be two of them on the table.
Yes, there is.
Take
Thank
either
you.
one or both.
I liked her. She was nice.
Yes, nice. First time I met
At
her.
least she was thorough.
Yeah, first time I met her, Joe.
I'm gonna do your vital signs before I leave.
Hey,
too.
Joe, I got 50 of those. If you like that one, or I'll give you a different one. Whichever kind you like, use that. I'll give you a different kind.
All right, I'm gonna write on here. I'm gonna try spelling Finley.
Dishwashing detergent. Like the guy who flew that 767 into Chicago years ago without a crew. Now would somebody please tell me what in Sam Hill he's doing up there? The radio's gone dead. Elaine, try the emergency phone.
Help us, please.
Thank you for calling the Mission Control Emergency Line. All our operators are busy, so please stand by.
Ted, it's a recording.
Let me have that.
We said all our operators are busy, so please stand by.
I told you about the boys downtown are taking the heat from the boys in Washington. You realize, Commissioner,
president. Sorry to put you out of bed at this hour. Forget it. I was reading. What's the story? Well, it's about an old man who catches this great big fish. But that's not important now, bud.
Sir, we have restored radio contact.
Good. We keep losing the radio. Give me straight. What's it look like?
A radio?
What? Bunch of big green with numbers, lots of knobs? What? I mean, the situation. What do your people think? They're screwed. They're dead. Did I leave the iron on?
West Side Medical.
Come in control.
Yeah. We read you, Striker. Come in over.
Krosky, I got
Elm Grove. They're on Elm Grove, Joe.
I don't think there's
Okay,
any way
good.
you can
That's fine.
regain control of this ship.
Striker. This is Steve McCroskey.
Used to work in Elm Grove Road.
Now, I want you to listen to me now, and listen good. A few
You might be able to, I think there's one on the east side too.
remember, through a storm. What was
I'll look
I
them up.
did-
I'll look
Yeah,
them up.
but I wrote that. I put lift chair with infinite position or similar, West Side Medical.
What's it called?
West Side Medical Supply.
The chair?
A lift chair with infinite
Okay. Yeah.
position or similar. Something's gonna be comfortable, something you can even come up a little bit and adjust your height when you stand and transfer, but something that's gonna put you, even at zero gravity, something's gonna relieve that pressure, something you should try out the positions when you go and say, oh yeah, that's gonna feel a lot better when I sleep.
You say so, Drew.
Stay calm. Keep an eye on those gauges.
I wouldn't have any idea, brother. Never been there, gonna do
Figure
that.
out somewhere around that computer from down here. Over now.
What are we gonna do, Ted?
Appreciate that.
Elaine, we're gonna have to blow the computer.
Little rock?
That's right, Elaine.
Ted, there's no way you can do it.
What do you mean?
That computer has a self-defense mechanism. I don't know how we can get around it. We've already lost 3 men, and I don't want to lose you too, Ted.
I guess it's in God's hands now.
I'm Father O'Flanagan. I'm a man of God. And you must trust me when I say it's very
I might use you for my supervisory visit, that would be good. We have to do an annual supervisory visit, but you'd be an interesting one to see, I think.
The supervisor's gotta come with you?
Yeah, my supervisor comes out and does a visit with me.
I got no problem with that, bro.
They wanna make sure I know what I'm doing, if I know what I'm doing.
This time, they don't have any confidence in you, but there's something wrong with their brains.
On,
Our top story tonight, 4-alarm fire rages through downtown Buffalo. Also in the news, lunar shuttle heads for the sun and certain disaster. Our top story tonight, 4-alarm fire rages through
so I kinda wrote, I'm gonna give you a picture of the exercise I want you to do. But continue with elevating legs above level of heart. Prosthesis on for a couple hours, take it off for an hour or so. Just, yeah. Just work with it a little bit. And I think next time I come, I think we'll actually, let's get outside, let's open it up a little bit more. And that'll be good if she comes with me, because then I'll have another hand. That'll be good, just for the first couple times, but I think I might wanna see how you do getting around outside with the prosthesis, wearing it a little bit more in here in a functional standpoint. So maybe within those 2 or 3 hours you have it on, you can get up and walk to the bathroom and back and stuff like that with the walker. Was that something you did before?
Yes.
You pretty much wore the prosthesis there today, right?
Well, if I was gonna do anything, if they didn't, in other words, it was so easy for me to use, it just didn't matter.
Okay.
And, I got to the point where I was, walking outside with my, cane. And I had enough confidence that you down the street, go down a
Yeah.
couple blocks, and
That we'll have to work on. That's gonna come down the road. Right now, we wanna get you walking again. That's the most important thing. And having 4 points of contact with the floor versus 1 is important.
That's what I do.
So I'm thinking, let me do your vitals. Let's do that first, and we'll talk about an appointment next. Maybe on Monday. I can come on Monday. I think that's when she said she wants to do it. I had another one, but you're more interesting, I think.
Is that good or bad?
No, it's good because, you're amputation, and you haven't walked, and we got the prosthesis adjusted, and some other things. I think that would be good.
I can't believe that a handicap, my prosthetic designers were not doing what you told me.
Not wearing that, yeah. Even
Hours before.
right. Even the first therapist who came here probably should have told you to wear the liner. or the liner for the sleeve for the thing, because that's going to give you more compression.
Yeah.
Did he give you more shrinkers or no?
He gave me a couple socks.
Okay.
They said the socks, they told me the socks.
But did he say too, you should probably wear the sleeve to get some of the swelling down? What did he say about your swelling, or it was pretty good when you went?
Yeah, well, like I say, Joe, you know, I've been wearing the sleeve for the prosthetic for like 4 hours before I went over there, so it was not a lot of swelling, but they gave me 2 of those. So, those are new. They said that I got one just like them.
Yeah, prosthetic shrinkers.
Yeah,
Yeah.
but they said mine are too stretched out.
There are 2 stretched out. Yeah, so try those.
Yep, I'm using it. I got one. Matter of fact, it's right there.
Excellent.
So this is what I usually put on at night, Joe. It's brand new, you know.
Good. Yeah, that's what you want.
Okay. Then when I
Yep,
get
that's
up,
what you want.
I put the prosthetic sleeve on about 2 hours before I try to walk.
Good.
By that time, you know, and yesterday it didn't seem, that's because you told me what to do. But also, yesterday it didn't seem that it was so hard for me to get out of it either for some reason.
Yeah, it came right off today.
Yeah, why is that?
Because of the swelling.
Oh.
Yeah, if you jam it down in there, it's gonna go like that, and it's gonna be harder to get out.
Anyway, Joe, like I say, you're getting me off the ground, Joe.
We're going. I have full confidence we're gonna rock and roll.
I appreciate that, Tony.
We're gonna have, yeah.
I really miss Dr. being able to always see my neighbors without their doctors.
Oh, yeah.
Doctors like me.
You're a good guy.
Kitties don't.
Dogs, no.
The only animals that have a problem with is cats or horses.
Oh, really? I got thrown off, almost broke my neck on one. I was dating this chick out in Trumansburg, and she was a Long Island girl that went country.
I haven't been there in a while, Trumansburg.
A lot of horse people out there.
Well, I went to visit, I didn't realize I had a cousin in California, which I did, my father told me, took me to meet her, and she had 2 horses, an old mare and a young stud. We go to see the old mare, she loves me, we talked, you know, she told me who she was and all that stuff. So then my cousin says, I want you to meet the stud, the man and stud, right? So this horse comes out, big guy, he turns his head to the side, looks at me like this. He goes, go ahead, Kevin, and I go, so she sends me around a week later. It's a good thing you didn't pet horses. I said, why? She took a chunk out of the fence because he had a sour stomach.
Oh, yeah.
Go ahead, pet my horses, you know, okay. Anyway, like I said, his mother was fine, but he was a bastard. He was funny. Anyway.
Yeah, I rode with her once. We got on. She had this long white hair, loud Italian, Long Island girl, nice body. I mean, she was like, oh my God. She was wild. I always dated the drama girls. I like that excitement. But now I have one that's laid back, non-confrontational. It's better for me, but I did like the other ones.
I got a girl just like that when I was in college. She was a sorority girl from anyway, she was one wild kid.
Oh.
She wanted me to hear about sorority girls talk. She snuck me into the meeting. She said, you must not speak. If they find out about you, they'll throw me out. The things you girls talk about, you think you and I are dirty when we talk? Holy shit.
Oh, yeah.
Damn, Joe.
Oh, yeah.
Nina was one hell of a thing. Yeah. She was 10 too, I think. Forgot her last name.
Plane in space leaves no traces for the insurance investigators. There's $1 million policy.
What's with that arm? Did they have trouble with that arm before?
Everybody can really just kind of thing. Actually, neither arm is all like that.
Suicidal and incredibly stupid.
From the back? Did she try to get your blood pressure was today?
Yes.
What was it?
It said 120 over 90.
Just relax now.
This cockpit is getting unbearable. You can fry an egg on this control panel.
You have 126/64. What does she have?
I thought you said 128/90.
Oh, high, yeah. My diastolic is a little bit than that.
I forget what the numbers mean.
No, it's a good measurement that I have. That's good.
I mean, I forget what,
Right.
what is when your heart is, what is when the vessel is expanded and what
Mhm.
relaxing or something?
Exactly. Systolic expanding, diastolic relaxing.
Is there something ratio that's supposed to have, or?
Well, yeah, there's parameters.
Oh, okay.
You better fasten your seatbelt. Sir, I'm afraid you're gonna have to put your cigarette out.
I want to listen to your heart.
It's got a little heart, all right.
Huh?
That heart with the valve,
Oh, yeah, yeah.
The valve's not gonna get back.
Yeah, well, I can hear the murmur you have. And just breathe normally.
He's carrying a bomb. No, not a bomb. A bomb. Now, as discreetly as possible, I want you to move the passengers into the lounge.
We don't have a lounge.
That's not important right now. What you've got to do is get those people away from that bomb.
Well, what should I say?
Anything. Just don't let Salucci think that we're on to him.
I'll do my best. Attention, ladies and gentlemen, please.
Would everybody move to the lounge who is not carrying a bomb?
That's good. That's 64.
Stay where you are.
You're good?
Yeah.
You don't want to blow that thing and kill all these innocent people? I don't care about them. Joe, listen to me. It's hopeless. No one's ever gotten away with a stunt like this before.
Pain? Any pain right now, Joe?
Why does it keep it forward?
Want to listen to your lungs?
Joe, you gotta trust me.
Deep breath.
No one's gonna hurt you. No one has to know about your problem. No one has to know you're impotent. Don't say that word!
One more. Got it. Good. Last one. Good. Won't sound good today. I'm gonna have you sign out on this one.
The good news is you don't need to live in pain. Why? Because there is Omega XL, a one-of-a-kind, natural, powerful joint.
Yeah, leave it off for just a little bit longer. How long did you have it on before I came here?
About 2 hours.
Yeah, leave it off for about another half an hour or so. Let it chill out for a little bit. And then put it back on. How do you feel? I mean, are you gonna try to walk or not? I want you to be careful because I don't want you to fall.
Yeah, I understand. Yeah, I'm gonna try further. So what I'm doing that right now is just sort of like leaning, going back and forth.
Just stand. Work on your standing. And working on equal weight distribution, shifting weight from side to
Yeah, I'm
side.
having trouble with that right now.
Yeah, you could do that. Do that at the island. On this side. You go on this side and do it, but that's more stable.
Yeah.
And you can kind of shift from side to side. Or you can do it, and the chair would be right behind you in case you needed to sit. That's what I would do, is work on standing tolerance. And standing up tall with just, light contact, just enough to keep you balanced. Work up to a minute, work up to 2 minutes, work up to 3 minutes.
Before I start walking.
Yeah, don't walk. I mean, if you feel safe walking right now,
Not bad, not bad.
I don't want you to fall.
It's just with this thing here, Joe, I've got some mileage with it, and it works.
Okay.
It works.
We'll be back. I'm going to be back on Monday. I'm thinking probably. Let me throw something. Let me clean this up and throw something out to her right now.
Or let me just,
Make sure you don't got anything going on.
yeah, so where's you that now?
I put it back.
Where's you keep it?
No, I don't eat. That's okay.
I buy them 12 at a time, Joe.
Oh, thank you. That's very nice of you. Thank you. I like that one.
I just want to make this fun, right?
Yeah, it is nice.
Just want to make sure the cartridge is full, should be brand new. No, we'll get you a thing.
Oh, you don't have to, that's fine, Joe, I just need to get home and get one, that's all.
I just go over the time, Joe. I'll be right back.
You're too funny.
No, I just, I like,
You're a good guy.
I like,
You're a typical Italian.
that's true.
You give everything away.
Well, my mother taught me that, and I.
Oh, I know, my father was the same way, I am the same way.
And my grandma too.
Even a shirt off your back.
And my cousin.
Making your life just like it did in mine.
Why wait? Try Omega XL today. Pick up your phone and call the number at the bottom of the screen right now for a special offer. Buy one bottle of Omega XL and get one free. Plus, you'll also receive a bottle of Vitamin XL D3 absolutely free. Buy one, get two free. 2 bottles of Omega XL plus Vitamin XL D3, a value of more than $85. Call today and you pay only $39.95. Plus, it's backed by our 60-day money-back guarantee. 2 bottles of Omega XL plus Vitamin XL D3 for only $39.95. Act now.
Meet firefighter Andrew Washington, one of America's Vinia heroes from Hope, Arkansas.
You just have to be ready at all times. You have to take down from 0 to 100 really quick. There's lots of this.
When lives depend on physical strength and mental sharpness, blood flow matters. That's why firefighters rely on Vinia, the red grape circulation superfood for better blood flow.
I've been taking Vinia for 6 months. It helps with blood flow. I can tell a huge boost. We all love that.
Vinia significantly increases the dilation of arteries and delivers oxygen and essential nutrients to your brain and heart to give you the sustained physical energy and mental.
So I think,
Oh, thank you.
This is a new one.
Thank you.
Press it open.
Up to 12 hours.
Just pull a little blue ball off the end of that, because it's a seal for it.
Okay, yeah.
It's not a scratch. Okay.
Okay, thank you, Joe.
So,
I appreciate that.
so you do a lot of good for a lot of people, really.
Aw.
I'll give you a pen for God's sake.
Thank you.
Like I say, I think I'm down to only 6 at a time. And when I buy 6 pens, I also buy 3 cartridges.
Thank you.
I go so fast. The other thing is, you can break the tip out of it, possibly, but it's once it deforms, it's not much good.
So let's try.
What the hell are you doing up there?
I got an idea, McCroskey, and it might just work. It's a long shot, but it's the
Let's see if we can do, how about between 10:30 and 11 on Monday?
I'd be crazy to try something like that.
You may be right, McCroskey, but I'm
I got nothing.
All right, good, I'm gonna put you in. Right on.
What's the date on it?
That's the 22nd.
I'm taking her to 0.5 warp.
0.5 warp.
0.5 warp. I test piloted this shuttle, McCroskey. I know exactly what it can do.
Strider, listen to me now, and listen good.
10:30, 11, you said?
Yeah,
Come apart on you with that speed, and that's no good. It's gotta be.
about 10:45ish, yeah.
That's what you do.
You know damn well that warp drive has never been tested. You're putting yourself and everybody else on that ship in jeopardy.
All right, I'll take care of that.
Testing 38. Art, I'll take air shuttle disasters for 40.
The answer is the Mayflower.
Dad, what are you gonna do?
Elaine, I'm going back there with your mom.
Dad, you're my hero. Dad, Mom. Dad, be careful.
Now listen to me, listen good. If you got any ideas at all, now is the time. I want to hear them, and I want to hear them now.
How about a game show like Hollywood Squares, but with kids? Gary Coleman.
What are you laughing at?
Funny you should mention this, I have to tell you. The family name was Trombetta.
Uh-huh,
My daughter went to Sicily, which is where we're from,
uh-huh.
and there's a Trombetta Park.
Oh, really?
Yep. I don't know which city is Sicily, but there's a Trombetta Park.
Joseph, good job today.
Likewise, sir.
Yeah, well, when I come on Monday with Sarah, Sarah's gonna be, who's the supervisor's coming, she's awesome, you'll like her. Very, very nice. And that'll be good. Then we'll walk a little bit, get you outside and open you up a little bit with that walker. Because, you know, the other key is, you know, you used to walk out of here with that, with something, right?
Just a cane.
We're gonna get to that, I think.
I got started out with the rollator. But see, the thing about a rollator is when you park it, I can sit in it.
That's a nice thing. So we need to start there.
Yeah, the only thing wrong with it is you can't steer it. you sit in it, you can't steer it.
No, you shouldn't be, yeah, those are not designed to, use as a wheelchair.
That's correct.
They're very dangerous.
It's specifically not to,
Yeah, but you'll flip right over on that.
Yeah, I found that the hard way, thanks, Joe.
Did you?
I didn't flip it, but I came goddamn close.
Scared the shit out of you, right?
Some guys are like that, you know what I'm saying, Joe?
I know.
Some guys gotta push it to the end.
I know.
I think that's why all my instructors in the service used to pick on me. It's fun. They wanted,
They'll do it.
They wanted us to learn to shoot the rocket launchers.
Right.
Normally in my training section when to shoot, they made me shoot, of course I loved it.
Yeah.
They made me shoot 24 rockets. It's great, love it. That's my favorite, you know, I told my son, I think first, because of the criminals are gonna have robots, I think, there's gonna be a big market for personal rockets.
You think so?
Uh-huh.
This world's going to hell.
I don't know. President Trump's trying to solve a lot of problems, but these people have been burrowed in their government for 50 years. I don't know what, I'm not sure anybody can solve it, Joe, but he's got some sharp guys there.
He does.
As long as they don't manage to kill him.
Right.
I can't believe it. They killed that Christian kid, Charlie Kirk.
I know.
What the fuck is that?
I know. It's crazy.
No,
It's crazy.
It's all by design, Joe.
And how, that's what I heard something. I mean, how could that guy get up there without anybody? I mean, he was in plain sight.
When the kid shot Trump the first time in Butler, Pennsylvania, the next day, the roof was washed down and his body was burned.
Really?
Yep. Who could do that?
What do you think? All right, JoJo.
Yowzer, thanks, Steve.
Please be careful. I don't want to come back on Monday and you fell. No. That'll be a bad supervisory visit.
That's
So
good.
to keep yourself safe until Monday.
All right. I'll give it a try, Joe. Thank you, sir.
All right.
Appreciate it.
Have a good one.
Stay out of trouble, sir.
Oh, so fun, but yeah.
Nice wooden car you got there, buddy. Yeah.
Probably one of my last ones I'll ever have.
Why?
No, yeah, I think it's gonna run with all-wheel drive.
Oh, what's wrong with that?
It's a Camry.
Yeah.
Loaded. It's a hybrid.
It is?
Gas and half electric.
No kidding.
450 miles with tank.
Holy shit.
Charges itself. I don't have to plug it in.
It charges itself. I never heard of that.
Yeah. I already got it down.
I guess they do.
They were smart because they didn't go totally electric.
Yeah, that was well,
That was a big decision.
they were counting on the big tax rebates, and now it's gone.
We know expensive. I got 3 batteries in there. You know how expensive it is to replace those batteries? I got big warranty on them.
20 grand, something like that?
They're expensive.
Yep. Joey, the car charges itself.
Yeah.
Holy shit.
In case some of you are wondering, we are traveling 1/2 the speed of light. Some of you might experience a temporary metabolic change, but there's nothing to worry about. Thank you.
Commander Murdoch? Sir, the main tower's in trouble. She's coming in hotter than a firecracker, sir. Their computer's down, they've lost their crew, and they're flying on manual control, sir. We better get to the tower, Lieutenant. We have no tower, sir. No tower? Just a bridge, sir. Why the hell aren't I notified about these things? Lieutenant,
see. Pretend nothing has happened, and hope everything turns out all right in the morning.
Just a thought, sir.
I've considered that. There's got to be a better angle.